Hello, everyone. Thank you for joining us today. Today, we will be presenting on exploring promising practices on diabetes management and prevention webinar. This is brought to you by the National Center for Health and Public Housing. And before we get started, we're going to go over a few housekeeping items. First of all, thank you for joining us today. This is just a reminder that all participants are muted upon entry. If you have any questions, any concerns, or any comments, or any promising practices that you would also like to share in relation to today's topic, please make sure that you submit that in the chat. Also, raise your hand if you would like to unmute your line during our Q&A session. This meeting is also being recorded, and the slides and recording link will be available via email after today's webinar. So this is just some information about NCHPH. Before we start, a little bit about our organization, the National Center for Health and Public Housing. The mission of the National Center for Health and Public Housing is to strengthen the capacity of public housing primary care grantees and other health center grantees by providing training and a range of technical assistance. NCHPH is a project supported by the Health Resources and Services Administration and is national training and technical assistance partner, is 100% financed by this grant, and the information presented today are those of the author only. So today, just a brief introduction about today's speakers. First of all, thank you, Chantel Moore, for joining us today. Ms. Chantel Moore is a North Carolina native. She has over 4 years of experience in social media strategizing, web design, photography, and layout and design. She holds an MA in communication studies from the University of North Carolina at Greensboro, a Bachelor of Science in Mass Communications, and a Bachelor of Arts in Political Science from the University of North Carolina at Pembroke, and she is our communications manager. And then more information about me. My name is Filipina Sandoval, and I am the TTA manager here at NCHPH. And at NCHPH, I basically provide analytical, technical, and logistical support to the team. And I am currently working on completing my MPH. And on my spare time, I enjoy exercising, doing a lot of outdoor activities, and always trying to learn new skills. So for today's learning objectives, first, we're going to learn about how diabetes promising practices we're going to define the diabetes promising practices in health center settings. We're also going to explore some of the examples of promising practices in public housing health center settings and other organizations. And we're also going to demonstrate how to navigate NCHPH's Promising Practices website portal, which is something that our communications manager will be doing towards the end of our presentation today. So before we continue, we're going to go over some of the data that is related to health centers close to public housing. So as of 2021 UDA's data, there are over 1,000 federally qualified health centers that serve 30 million patients, 458 FQHCs that are in or immediately accessible to public housing that serve 5.7 million patients, and 108 public housing primary care grantees that serve 911,683 patients. So here we have some information about our public housing demographics. As of 2022 HUD data, HUD resident characteristics report data, there were 1.5 million residents, 2 persons per household, 38% that were disabled, and also 52% that were, in terms of ethnicity, 52% that were white, 91% low, that were low income, 43% African American, 26% of Latino race, 19% that were elderly, 36% children, and 32% that were female-headed households with children. So to give like a brief background about the diabetes information related to public housing primary care, it is good to have an understanding about the different percentages that encompass the total numbers of diabetes. So here we have in all FQHCs, there are a total of 30. The percentage of patients with diabetes was 10%. Public housing primary care, we had a 10% percentage, a 10% of diabetes. And then also in our immediately accessible to public housing, we had a 22% of patients that had diabetes as well. So here we have the collection of promising practices in diabetes management and prevention. So in this publication, the National Center for Health and Public Housing compiled a set of promising practices on how to improve the health of public housing residents through diabetes management and prevention strategies with health centers. These strategies were identified through various webinars and learning collaboratives that were conducted by NCHPH over the last 3 years on improving diabetes management and prevention. And the purpose of the document was to provide health center staff with easy access to diabetes promising practices. The promising practices are also available online through a Promising Practices Portal, which Chantel will go over later. So the promising practices that were chosen were based on the following definitions identified and created by the Health Center Resources and Services Administration and also by the Health Center Resource Clearinghouse. And these were created to provide training and technical assistance to health centers. A promising practice generated at a health center must demonstrate at least 3 of the following items that we're going to go over in the next few slides. So first, they must represent or reduce costs. They have to have the potential to lower the per capita cost of delivering care services. They also have to have a partnerships characteristic. The approach creates innovative, strong partnerships and maximizes efficiency. They also have to have a characteristic of operational feasibility, which offers strategies that can be easily shared and implemented. And also in terms of impact and outcomes, the guidelines and protocols, they have to follow guidelines and protocols that have been successfully used by at least one organization and with an emerging positive track record of improved clinical access or operational outcomes and insights. They also have to have a satisfaction characteristic approach, which demonstrates effectiveness in increasing overall satisfaction for patients or staff, and also data collection mechanism, which provides data to support the establishment of benchmarks. So why do we want to explore diabetes promising practices in health center settings? So first of all, they provide examples of different models that will improve the overall diabetes outcomes for patients by preventing or delaying the onset of type 2 diabetes. They would also help in lower healthcare costs. And also these examples will ensure that patients receive timely, equitable, and quality healthcare. They will also improve the management of diabetes among patients that have other comorbidities like cardiovascular diseases and kidney diseases, and also improve team care by providing regular trainings on how to care for patients with diabetes-specific needs. So now I'm going to open up to Chantel. If you can please ask these questions to the audience.
Sure. Thank you, Fida. What is an example of a diabetes promising practice that your organization or health center has implemented? And second, how did this promising practice help improve the health outcomes in the patient population?
And these 2 questions, we're just going to kindly ask you to please provide your responses in the chat, and we're going to allow about 3 minutes for you to provide your responses.
Okay, we do have one response, FIDE. Maria Mendez says that they have CHWs who meet with patients one-on-one and provide education on diabetes management.
Great, thank you so much, Maria, for providing that feedback.
We have one more from Denise. They provide diabetes education sessions with nurses. We have another response from Casey that they have a dietitian who specializes in diabetes management and provides in-depth one-to-one medical nutrition therapy. Kathleen says that they have came up with auto referrals with newly diagnosed people with pre-diabetes, diabetes, or uncontrolled diabetes with an A1C of 9%. Arcelia says that they have a veggie bus that comes to provide fresh vegetables to their diabetes patients.
Wow, thank you. Thank you, everyone, for providing these responses. Okay. I believe we have two more responses, Chantel.
Yes. We have Paulette, who says that they're using data science to identify the diabetes risk level and then implementing interventions on the risk level. And then we have a food, Casey has a food pharmacy program that offers healthy foods and associated diabetes and nutrition education to eligible patients. And lastly, Kathleen has team-based care with PCP, CCC, RD, CDCES, and CHWs.
Thank you. Thank you so much, Kathleen, and everybody else also for providing these promising practices. Especially with the team-based care, that is something that we're going to touch base later on during the presentation today. We do have an example of a promising practice. And also, I'm curious to see how, for Paulette, how is that using data science? How has that, how were you able to implement data science in the interventions? Could you please elaborate just a little bit more on that? Yes, for sure. Let me go ahead and unmute your line. Hi, Paulette.
Hi, can you hear me?
Yep.
Hi, yeah, so I work for a health plan organization, and what we're basically doing, especially with our enterprise analytics team, they're looking at claims data, at hospitalization, inpatient hospitalization, ER visits, and just looking at trends, at potential trends and forecasting where the patient who has diabetes may land, and then putting them in the high, medium, or low risk bucket. And according to that bucket that they're in is the intervention that they'll receive. So whether it's a digital intervention or care management, there are just different interventions assigned to the risk level, and basically just looking at the cost savings of all of those risk levels. So there's a lot more that goes into it, but just really basically looking at the member's history and forecasting their trend.
Oh, that's very interesting. I think it's extremely interesting seeing how you guys are able to forecast also those trends based on the data that you're receiving. Okay, thank you so much. All right, so now we're going to continue. All right, so for today, this is just a brief overview of the diabetes promising practices in health center settings that we're going to go over. So first, we're going to go over on strategies and team-based approaches to wellness. Another example of diabetes management and prevention through the integration of information systems and technology. Also implementing medical nutrition therapy, health literacy improvement strategies, and the adoption of the Seek, Help, Assess, Reach, Evaluate approach. So for this first example, the team-based approaches to wellness takes into consideration basically the chronic care model, which is composed of 6 elements that optimize the care for patients with chronic diseases such as diabetes. And these elements include delivery system design, self-management support, decision support, clinical information systems for patients to access their own information, that also connect individuals with community resources and policies and health systems. And these team-based approaches to wellness also focuses on implementing strategies for system-level improvements, where care teams should prioritize the intensification of lifestyle and pharmacologic therapy, specifically for patients with diabetes that have not achieved metabolic targets. So these strategies for care team-based intensification include setting collaborative goals with patients, addressing and identifying barriers that are related to language, numeracy, and cultural barriers to care, integrating evidence-based guidelines and clinical information into the process of care, and also providing structures, obtaining feedback from patients, setting reminders that will help meet targets, and incorporating care management teams. So here we have basically an analytic framework for the team-based care for diabetes management. And if we can see on the left-hand side, we have a team-based care, which represents the intervention. Then if we move on to the next column towards the right, we have the intervention, the intermediate outcomes, which encompasses the improved patient support and improved system support, which that includes the treatment and medication management, adherence support, support for self-management and behavior change. And also at the bottom where we have the decision support tools, information systems, and surveillance systems. And also in the blue box towards the right, we also have the improved health processes and patient experience, which that includes testing, monitoring, all of those things that are included within that category. Patient adherence and diabetes self-management and patient experience, which are things that definitely impact the target population, which are the persons with diabetes. Then that leads us to the recommendation outcomes, which includes the improved immediate health, improved intermediate health on glycemic control, lipid control, and blood pressure control, weight control. And then also we have the reduced complications, which is the retinal therapy, decreased vision, and then a lot of these other more clinical aspects of the disease. And then lastly, we have the healthcare utilization, quality of life, and mortality, which includes reduced hospitalizations, improved overall quality of life, and improved physical health and mental health, and also the overall reduction of mortality due to diabetes. And then next we have the diabetes management and prevention through the integration of information systems and technology. So this is an example from a health center program grantee at Bay Area Community Health Center, which is located in Fremont, California. And they established a panel to produce better processes and results that have enhanced diabetes care among their patient population. And this is managed by the health center's wellness department with case managers, RNs, LPNs, and medical assistants that also help coach all diabetes patients within this health center. With the use of the panel, Bay Area Community Health Center also was able to follow up with their patients daily and set up timeframes on when their case managers will follow up with patients depending on their A1C levels. And the higher the A1C levels, the more frequent the follow-ups were for patients, and coaching was available for them through telephone. Additionally, the case managers also saw patients right after their initial doctor visits to provide one-on-one counseling and whole diabetes-related classes that included nutrition and exercise information. This strategy also was shown to be effective as patients saw a change in their blood glucose levels and when their baseline of glucose levels measurements were compared prior to attending diabetes classes to after completing the classes. So the tools provided for their patients also included the use of care messaging, where messages were sent out to patients through text messages by their coaches. And this campaign lasted 25 weeks. In the next promising practice, we have a diabetes management and prevention by implementing medical nutrition therapy, which is something that was provided during the chat. Thank you so much for that. And this is provided by the American Diabetes Association. And basically, the medical nutrition therapy consists of using nutrition as therapy to treat a medical condition or a disease. And MNT, which is the abbreviation, is provided by registered dietitians to engender behavior change in relation to adopting a healthier lifestyle and making better nutritional choices. MNT is also a comprehensive therapy where patients follow a plan based on established goals between the registered dietitian and the patient, and is also a service that is a Medicare covered benefit that is cost effective and that has shown to improve A1C levels with an absolute decrease of up to 2.0% among patients with type 2 diabetes and up to 1.9% among patients with type 1 diabetes within a 3 to 6 month period. Then for our fourth example, we have diabetes management and prevention through health literacy improvement strategies. So this example is provided by Sufal Health Center, which is located in New Jersey. And basically, they came up with a medication adherence tool called Improving Adherence Tool and Brown Bag Medication Management. And this is a tool developed in collaboration with the health center pharmacists to help improve the health literacy among health center patients at Sufal Health Center. The purpose of this tool was to serve as part of the teach-back method as a personal medication record, also a medication plan, and also to evaluate how high the health literacy of patients was by engaging them into medication plan conversations. This medication adherence tool was implemented by following the simple steps that we have on the screen, where the S stands for simplifying the regimen, the I stands for imparting knowledge, the M stands for modifying patient beliefs and behaviors, P, which stands for providing communication and nurture, trust, and the L, which also stands for leave the bias, and E for evaluating the adherence. So here we have an example of the tool. So this tool basically helped patients improve their adherence to medications as they were able to understand in a simpler way the processes and what was going on with their medications for diabetes. The tool also addressed issues with cognition, as some patients were forgetting their dosages, especially among elderly groups. And it also helped identify solutions on how to mitigate literacy issues, engage patients, reduce side effects, and enhance the acceptance of their medication regimens. This adherence tool also provided support for the health center with quality improvement initiatives, and was also a tool that patients were able to take home. Next, we have an example on also on health literacy improvement strategies by La Maestra Community Health Centers. And the promising practice here is the use of clinical pharmacists that provided support with adjusting medications. So La Maestra established the use of clinical pharmacists that provide support with adjusting medications as needed for their patients in conjunction with their treating providers. And La Maestra also implemented after-hour group classes to accommodate patients with their schedules, and which this program was shown to be successful. They established cohorts of 20 patients for the after-hour group classes, and in each cohort, there was a compliance rate of about 85%, which that is really good. The successes that were seen as part of the after-hour group classes include weight loss of 5 pounds in 4 weeks in some patients, aside from managing A1C levels among their health center patients. La Maestra also established new approaches for eye care, and this approach involves taking pictures with a retinal camera during examinations at the health center, where they were sent directly to eye specialists to ensure that proper follow-ups were completed with patients, as it was reported that patients had struggled to follow up with eye specialists on their own. This approach was believed to help decrease no-show rates among patients with diabetes and also increase compliance. Next, we have an example of diabetes prevention and management through the adoption of the Seek, Help, Assess, Reach, Evaluate, Share approach. And this is provided by the Agency for Healthcare Research and Quality organization, agency. And then the promising practices here is the Seek, Help, Assess, Reach, Evaluate approach, which is a process of 5 steps developed by the agency. And the Share approach is something that may be adopted by health centers to help improve health literacy for patients with diabetes and increase their knowledge about diabetes, self-efficacy, self-care behaviors, and how to control their glycemic levels. This approach has been well received by educators and patients in past trainings that have focused on medication adhesion. So this approach also includes 5 steps. The first step is the seek for your patient's participation. 2, help patients explore and compare treatment options. The third one, which also includes assess the patient's values and preferences. And the fourth step, which is reach a decision with the patient. And 5, evaluate the patient's decision. This tool contains a facilitator's guide, which will be provided in the link that will be sent out with the slide, and will be readily available for users to use on a step-by-step basis. So now I'm going to pass it on to Chantel Moore, who will be going through, she's going to provide a demo on how to navigate our NCHPH's website on the various promising practices that we have compiled.
Thank you, Fida. I've just provided the link to the Promising Practices Portal in the chat for personal reference, if anyone chooses to explore. Okay, so in order to access the Promising Practices Portal, you may come over to the top of the navigation pane, and it is right here in the resource library section. So welcome to our NCHPH Promising Practices Portal. So this is basically a digital version of the publication, whereas publications can be print or digital. This is something that is made to be readily accessible to health centers and constituents to be able to just go through and find promising practices. So we have compiled multiple sets of promising practices on various subjects, including diabetes prevention and management. Strategies for diabetes prevention and management were identified through various webinars and learning collaboratives conducted by NCHPH over the last 3 years on improving diabetes management and prevention. So I'm going to take you guys through the first page. So here you have 2 options. You can search for a promising practice this way and just click the search button. Or you can just briefly select a category and it will take you directly to the category. In the middle, we have our promising practices definition, which is just the basic criteria that is needed to be met in order to be considered a promising practice. In addition to that, we have our source of information, and links to 3 publications that are all promising practices related. So for the sake of this webinar, we're discussing the promising practices on diabetes management and prevention. So if you'd like to access the publication, it'll take you to our NCHPH website if you click here, and then you can view the publication that way. Lastly, on the front page, we have a few videos that are our training and technical assistance events that contain promising practices. So next, we have our resources section. So these are the resources that were mentioned in the publication for diabetes and other subjects. So the resources are organized by the topics. So for an example, what FIDA was recently discussing, this is a category here, and then these are some of the sources that were used in that category. And that just continues throughout the remainder of the page. The training section contains all of our, well, most of our trainings on these particular subjects. And if you want to see even more than what we have to offer on these pages, you can just visit nchph.org. These are some of the webinars that we did on diabetes. We also have learning collaboratives as well. These are all the ones that were mentioned in the publications. So for a more extensive view, just please visit nchph.org. Next, we have our evidence-based practices. This is just providing a firm definition of what an evidence-based practice is. And you also have an option to search on this page as well, or view more information from each category. So if we go here, you can see all of the diabetes-related materials that we have in terms of promising practices. And then over here, we have our promising practices submission form. So if you or your health center have any promising practices that you're doing to improve our communities, please feel free to fill out this form, and we will be able to review this material and add it to our website. So this is something that you can pass on to all of your health center employees and coworkers, et cetera. And then we just have our contact us page. If you have any other questions, you can fill this out and we'll be more than happy to get back with you and answer any questions that you may have. And that concludes my presentation.
Thank you so much, Chantal. All right, so now I'm gonna open up the Q&A session portion to the audience. If do you have any questions or anything that you would like to share with us? We also have on the line our Chief Medical Officer, if there are any clinical questions that you have related to diabetes promising practices. So I'm gonna allow a few minutes. Okay, so Dr.
We do
Leon,
have one.
I'm sorry.
Yes, we do have one from Kathleen. She says, how do you engage participants to participate in MNT?
I believe this is more of a clinical question. Dr. Leon, would you mind responding to that?
Sorry, guys, I was muted. I'm sorry, Chantel, what was the question again?
The question was, how do you engage patients to participate in MNT?
You know, the nutrition therapy is something that health centers are working on. It will depend. You have to do a lot of patient-centered approach, and we've been working and we've been doing a lot of some webinars on this particular issue. But being honest, based on the patients that are served by health centers, for instance, we are going to have a webinar, for instance, tomorrow about food culture. So it's going to be very difficult sometimes to change every, the way people eat if we don't understand their background. So one of the first approaches is just to make sure that we understand the background of our patients, making sure that we understand the culture, making sure that we understand the patterns. Sometimes the way that we eat or the way that we have our meals depend on our family, and all those issues we have to take them into consideration. And then once we do that, then we need to make sure that we approach, you know, what other needs the patient may have. Specifically, patients with diabetes have other chronic medical conditions as well. So we need to also make sure that we understand and we address all those medical conditions. Talking about cardiovascular diseases, hypertension. And once we have a real understanding, we need to work with a dietitian or someone who can provide all these recommendations to our patients. But again, we need to make sure that we individualized each of the therapies for our patients. Health centers are working a lot. We've been having conversations with many of the health centers. FIDE mentioned health centers located in or immediately accessible to public housing. So through our clinical quality work group, we address some of these issues. But again, to give a very general perspective, you know, we need to make sure first that we understand the culture and the background of our patients. Second, that we take into consideration other conditions. And third, that we work with the team. And if you have a nutritionist and someone who is an expert, you know, to provide these services to the patient. That's the general rule.
Thank you so much, Dr. Leon. And we also have a resource that was provided by one of our participants. This is a resource by the NDPP Prevent Type 2 Diabetes curriculum in multiple, well, it has that curriculum in multiple languages.
And we have no further questions in the Q&A section at this time.
All right, and then next, oh yeah, we do.
We have one now. Have some of the health centers you work with considered exploring adherence with GLP-1?
Another great question. I haven't heard anything from the health centers that we work with. Last week we had, no, it wasn't last week, it was 2 weeks ago. We had someone from the American Diabetes Association talking specifically about adherence of for this particular drugs and medications. I encourage Michelle to go to our website. Employer Sure Chantel, that is there, and he provided a lot of information. But at the same time, to respond the question from Michelle, we haven't touched that particular issue with the health centers, but we've had the ADA expert, responding to some of these questions. So I encourage Michelle to go to our website and look at the webinar that we hosted about 2 weeks ago.
Okay, we have one more. GLP-1, no problems with primary care providers recommending, but the biggest barrier is cost and/or insurance coverage.
That is correct. That's a big issue for those clinics and health centers and safety net providers serving low-income populations in general. This includes community health centers as well. But again, one of the concerns that I've seen a lot is sometimes we need to make sure that we train our medical providers, either your family practitioners or your medicine internal medicine doctors, just to make sure, because the problem with all this stuff, and that we are going to discuss in a future webinar, is everything that is related to clinical inertia. And one of the biggest concerns with clinical inertia is that sometimes you can address it from a patient perspective. You can also address it from a provider perspective. And when I've seen many surveys from some of the most prestigious organizations like AFP, saying that sometimes providers, even though are very aware of this topic, they are not totally familiar with all these kind of drugs and new medications and everything that is surrounding diabetes management. We need to remember that diabetes per se is a disease that is, we always have something new. We always have some new therapies. We always have new protocols. It's really difficult for providers who are not diabetes specialists to keep up with all this information. So again, even though cost, and accessibility are great concerns for health centers, we are also talking about how we can improve, how we can get all the new information for our providers. So those are the challenges to get all these new drugs and medication for our patients, low-income patients.
There are no other questions at the moment.
Oh, sorry. Thank you so much, Chantel. I was muted the whole time. But basically, I wanted to see if Cassie Serrato, are you available to maybe talk to us a little bit more about the food pharmacy program that you stated in the chat that you have at your health center? Maybe if I try to unmute your line. Yeah, thank you so much. Let me go ahead and unmute your line.
Are you able to hear me?
Yep.
Hi. Yeah, so my clinic, I work at a federally qualified health center, and we started a pilot program called the Food Pharmacy, where just for the pilot, it is specifically patients with diabetes, hypertension, or both are identified, who also are identified to be food insecure. And we do that based on some surveying, also if they have Medicare, Medicaid, SNAP, things of that nature. and it's a 12-week pilot. So they are required to attend medical nutrition therapy every 4 weeks. And then every 2 weeks, they get an allotment of fresh and frozen fruits and vegetables, lean proteins, healthy fats, legumes. And so far we are 20 patients in, and every single patient has either had an improvement in their A1C, improvement in their blood pressure, weight loss, and we do take that baseline data and data throughout the visits, and then at the end we do final data to see those changes. So it's been very successful thus far. Our hope is to increase it to 100 patients and get some grant funding to actually have a food pharmacy on site long term.
That's amazing, Cassie. Thank you so much for providing that information. And may I ask what health center are you joining us from?
Tri-County Community Action Agency in Johnston, Rhode Island.
Thank you. Thank you so much. So I believe we don't have any more questions, Chantel.
Not at this time.
All right, so since we don't have any more questions, please, this is just a kind reminder to everybody to please complete our post-evaluation survey and let us know your feedback for today's webinar. This is our contact information. If you have any other follow-up questions, you can always contact us, and this is our email addresses. For Chantel Moore, it's a cmoore@mgt.com. For me, fide@mgt.com, or for Dr. Jose Leon, if there are any more clinical questions that you would like to know about, jose.leon@mgt.com. Thank you, everybody, for joining us today. And see you next time.